Good morning. Thank you for joining us in this Facebook Live session. I am Dr. Amandeep Sangha, and I am a neurologist with Bon Secours Neurology Clinic at St. Mary's Hospital in Richmond, Virginia. As we have been talking about stroke, because our month of May is a stroke awareness month, so we've been trying to spread as much education regarding strokes and their prevention and treatment options as much we can. So continuing with this series, I would like to emphasize again that stroke is a leading cause of morbidity. It is the #1 cause of morbidity in general population, and it is the 5th leading cause of death in general population. And at the same time, I want to say that 80% of the strokes are preventable. Preventable means if we can control the risk factors, we can prevent them. There's very little you can do once you have a stroke, but you can do a lot to prevent them. So continuing with this series about risk factors regarding strokes, we will be talking about cholesterol as a risk factor and atrial fibrillation as a risk factor. Just to review the top risk factors again, they are hypertension, smoking, diabetes, cholesterol, and atrial fibrillation. And not to forget that lack of activity or inactivity is an equally important risk factor for having a stroke. So coming to cholesterol, what is cholesterol? Now, cholesterol is something that's normally circulating in our bodies, and by cholesterol, we mean it's made up of 2 specific molecules or entities called LDL, or lower density lipoproteins, and HDL, which is the higher density lipoproteins. In addition to that, the cholesterol molecule is made up of triglycerides, which is found in different fat storage sites in the body. Cholesterol is a useful substance in our bodies. Cholesterol helps with digestion. Cholesterol helps in synthesis or formation of a lot of hormones in the body. Cholesterol is an integral part of cell membranes in the body. So it's a useful substance, but at the same time, if we have too much cholesterol, it is a problem. It can start to deposit within your artery walls and start to clog them up and can lead to strokes and heart attacks. Now, as we mentioned before, cholesterol is made up of low density lipoproteins, or LDL, which is one of the bad cholesterols. Now, this is mainly a transporter of cholesterol particles in the body. And if we have excess of this, it will tend to deposit along the walls and clogging them off. So that's why we call it the bad cholesterol. And we have a certain range specified that we should keep our bad cholesterol on the lower side. On the other side, we have good cholesterol, which is the HDL, high density lipoproteins, because it helps clear up the deposited cholesterol along the walls of the arteries and helps transport it back to the liver. So it's a scavenger. It helps clear up the bad cholesterol. So that's why we want our HDL, or good cholesterol, to be up. Now, there are certain strategies that we can adopt to make this change, which means lower your total cholesterol, which is a combination of all the cholesterols, lower your bad cholesterol, and increase your good cholesterol. One of the most important interventions we can do is diet. We should learn about what are the elements that will increase your good cholesterol and lower your bad cholesterol. For example, saturated fats and trans fats. They are the bad type of ingredients to eat because they will affect your cholesterol unfavorably. So cutting down on those ingredients, read the fine print when you're picking up stuff for your cooking in your groceries. Fried food, for example, should be avoided because it's very rich in saturated and trans fats. Another thing that will affect your cholesterol favorably is exercise. Exercise will lower your LDL and it will increase your HDL. We have normal ranges specified. For example, if you've had hypertension or diabetes, you're over the age of 40 years of age, and then your cholesterol or bad cholesterol, which is LDL, is greater than 70, you should start adopting these interventions. The cholesterol can be increased just because of what you eat, but sometimes it's just genetic. No matter how healthy you eat, but your cholesterol numbers will remain high. And that is the situation when you need to talk to your doctors, and we have different types of medications available that will bring your cholesterol numbers down. And as we mentioned before, about 80% of the strokes are preventable because we can control and treat the important risk factors, cholesterol being the most important one.
Are there any good fats?
The good fats are the high density lipoproteins. These are the unsaturated fats or monounsaturated fats. You'll find this in ingredients. As long as it doesn't say trans or saturated fats, those are the bad fats. The other unsaturated or polyunsaturated fats are the good fats. Those are the good fats to consume. The other risk factor we want to talk about a little today is atrial fibrillation. What is atrial fibrillation? We know that our heart is comprised of 4 chambers, 2 top chambers, the atria, and 2 bottom chambers, the ventricles. Normally, there's a rhythmic contraction. The top chambers can contract and followed by the bottom chambers contracting. This is all in a very synchronized and rhythmic fashion. Sometimes what happens is because of the electrical conduction problems or disturbances or other reasons within the body, the top chambers of the heart will just start to flicker or flutter rather than effectively contracting. What happens in that is when the blood is not getting pumped out or the atria are not emptying completely, the blood tends to stagnate in there, and that is not good. When the blood stagnates, it tends to clot up, and that clot can break loose, go down into your ventricle, back up into your arteries, goes to your brain, and can clog any channel inside the brain, and that's what leads to stroke. And similarly, it's the same mechanism for a heart attack. So this is important. What are the symptoms of atrial fibrillation? The common symptoms are you can experience palpitations. Some people will feel dizzy, or sometimes suddenly out of nowhere, you just start to sweat and just don't feel right. You get tired easily when you're exercising, especially, and that could be a reason because there's not effective blood being pumped out of your heart. So if you have any of these symptoms, it's important to get yourself checked out. The common test they will do is EKG. Sometimes they will run a monitor for an extended period of time because, the atrial fibrillation may come and go. It's not constant. And that's the time when you're at risk, when it's there. So sometimes this extended monitoring will pick it up, and the routine regular EKG will not pick it up. There are different medications that we can use to control it. There are medications to control your heart rate, control your rhythm. We call it antiarrhythmics. There are other interventions like cardioversion, where the cardiologist will electrically try to revert the rhythm back into a normal one. And sometimes they will also recommend certain other rhythm regulating devices like pacemakers, etc. So these are the risk factors. They can cause strokes. And coming back again to the symptoms of the strokes, what are the symptoms of strokes? We commonly use a mnemonic, which we call B FAST. So B stands for balance, if there's any sudden appearance of a balance problem. E is for eyes, if there's any visual distortion or double vision. F is for face, if your face suddenly starts to droop on one side. A is for arms, if your arms or extremities start to become weak or numb. S is for speech, and your speech gets slurred. You may not be able to comprehend anything. You may not be able to express yourself at all. Word finding difficulty that just suddenly comes out of nowhere. The last one is T, which is for time. Time is of the essence, and time is brain when it comes to stroke. In good old days, there was not much we could do. Once you have a stroke, you are left with the deficit that was caused by the stroke. But nowadays, if you develop any of these symptoms, you should immediately seek medical attention. You should call 911 or get to the emergency department. Because in the early phases of the stroke, there are a lot of things they could do. They could give you clot-busting medications in your IV, and they can actually go in with the help of a catheter right in your brain where the clot might be and just pull and suck it out, giving you the best chance possible for a good recovery. And this is now the standard of care. Like I said, time is of the essence. It's only up to a certain duration of time that these interventions will be beneficial. If you wait it out more than, let's say, 6-8 hours, the amount of benefit you're going to get from these interventions is low. However, I will say that even up to 24 hours in certain parts of the brain, in certain areas of your circulation, you could do something. So you should get to the hospital whenever you can. The earlier, the better. Coming back to our stroke risk factor reduction, I would like to say that Bon Secours, in association with the American Heart Association and Stroke Association, we are doing our annual signature event called Jazz Up Your Health. It is on May 31st. It starts at 5:30 p.m. and continues until 8 p.m. and the doors will open at 4:30 p.m. It's a free event. It's free parking in downtown across from the convention center. And what we will have there is we will have Bon Secours staff. We will have experts from the American Heart Association to answer your questions. There will be live cooking demonstrations. There will be chefs and nutritionists who can answer your questions about what to eat, what are good foods to eat, what we should avoid, and how we can cook delicious meals, being healthy at the same time. So I'm hoping that you will be able to join us and get your questions answered. And of course, there will be live music, jazz music at the end of the evening. Hoping to see you there. Thank you for joining me.